Hi everyone. This video will talk about the preventions of HPV, known as human papillomavirus, associated with OPCs, known as oropharyngeal cancer. In this video, I will focus on three main preventative tools of preventions of HPV associated with OPC. First one, we'll talk about safe sexual practices. Secondly, we'll talk about HPV vaccination. And lastly, I will talk about screening HPV. So let's get started. As far as we know that HPV is the most common sexually transmitted virus caused oropharyngeal cancer through oral genital sex. Therefore, in order to prevent the people from HPV related to OPC, safe sexual practices such as condom and barrier contraceptive is considered an essential prevention strategy. There is a strong relationship between barrier contraceptive and oral HPV 16-18 infection, which cause OPC. Particularly, people who are using barrier contraceptives were significantly less likely to be HPV 16-18 positive compared to those not using barrier during oral sex. In addition, CDC strongly recommend sexually active people use their barrier contraceptives such as condom and dental gowns in order to reduce the transmission of a sexually transmitted infection through oral sex. Secondly, I will talk about the importance of HPV vaccination. It's important that it's inadmissible that HPV vaccinations is the primary prevention tool of HPV related to infections and oropharyngeal cancer. Therefore, it is really important that dental healthcare providers such as dentists and dental hygienists should discuss this topic with the clients. In controlled clinical trials, prophylactic HPV vaccines show 90% to 100% efficacy in preventing vaccines type HPV infections and associated anogenital precancerous lesions. In 2016, the pharmaceutical company introduced HPV vaccines called Gardasil 4, which against HPV 6, 11, 16, 18 with the initial goal of preventing HPV associated with cervical cancer in the woman. Apart from that, the World Health Organization, WHO, recommend HPV vaccination to be included in the national immunization programs in order to protect women from cervical cancer. In addition, another vaccine called Gardasil 9 protect against HPV 31, 33, 45, 52, 58, which cause over 90% of HPV related to cancers, including HPV linked to OPC. By 2011, CDC recommended routine HPV vaccination for both girls and boys from 9 to 26 years old for the prevention of cervical and anogenital HPV cancer. Lastly, I will talk about the screen HPV related to OPC. Screening HPVs is the secondary preventions of HPV infection regarding to oral cancers. Therefore, if dental healthcare providers know how to do the screen HPV, can help clients to prevent or early detect HPV, which can improve survival rate. It's noticeable that the most common presenting symptom of HPV related to OPCs is lateral neck mass. Screening HPV related to OPCs is very beneficial for high-risk population. Screening HPV related to OPC is the method known as cheap, minimally invasive, and appropriate sensitive to identify a high proportion. Another method called oral HPV screening also very good on detect OPC related to OCV. Oral HPV screening is the method to evaluate the presence of HBV DNA in saliva, focus especially on high-risk HBV such as cytine, which most cause oropharyngeal cancer. Apart from that, HBV serology is also a very good method to prevent HBV associated with OPC. HBV serologies either screen for antibodies to HBV16 protein. Thank you for listening, and these are the references.